A recumbent length measurement is taken on children ages 3 years and younger. The equipment used for this measure is a device with a fixed headpiece, a horizontal back piece, and a movable foot piece. The assistant supports the child's head. Similar to the procedure for standing height, the child's head is positioned in the Frankfurt plane. Gentle traction is applied to bring the top of the head into contact with the fixed headpiece. The child's head must be firmly held in this position by gently cupping the palms of the hands over the ears and holding the head in proper alignment. Simultaneously, the technician aligns the child's legs by placing one hand gently but firmly over the knees. The toes point directly upward, with the soles of the feet perpendicular to the horizontal back piece of the measuring device. Gentle pressure is applied at the knees to keep the legs straight. The technician then slides the movable foot piece to rest firmly against the child's heels. As quickly as possible, the measurement is recorded in centimeters from the measuring indicator to the nearest millimeter. To define the level at which the waist or abdominal circumference is measured, a bony landmark is first located and marked. The subject stands, and the technician, positioned to the right of the subject, palpates the upper hip bone to locate the right ilium. Just above the uppermost lateral border of the right ilium, a horizontal mark is drawn, and then crossed with a vertical mark on the mid-axillary line. The technician places the measuring tape around the trunk at the level of the mark on the right side. The technician then inspects all sides to make sure the measuring tape is in a level horizontal plane. Mirrors on the wall are used to assure correct horizontal alignment of the steel measuring tape. This is especially helpful for women with hourglass-shaped torsos and for overweight subjects. The tape is then tightened slightly without compressing the skin and underlying subcutaneous tissues. The measure is recorded in centimeters to the nearest millimeter. For the biachromial breadth measurement, the subject sits upright with a noticeable curvature in the lower back. The shoulders are relaxed, with the hands resting on the lap. The technician stands behind the subject. The shaft of the broad blade caliper rests at the base of the thumb and index finger of both hands. The technician uses the middle fingers to palpate the ridges of the acromial processes. When the lateral borders of the acromial processes are located, the bars of the sliding caliper are placed directly on them. The shaft of the caliper is aligned parallel to the shoulders. Pressure is applied to compress the soft tissue without inducing pain. The maximal breadth across the lateral borders of the acromial processes is measured in centimeters to the nearest millimeter.